China is reeling from a wave of COVID-19 infections. Hospitals are overflowing with coronavirus cases now that the country's abandoned its strict zero-COVID policies it had upheld for so long. Medical authorities say the current wave will keep worsening into next week. For those still healthy, the rule is keep out of each other's way.
It may only take a month from the beginning to the end for that to occur, with 60, 70, even 80% of people being infected. So we know the overall timeline, and there's this narrow window of opportunity to have actions now that would save people's lives.
Ruby Huang from the National Taiwan University is monitoring things in China. I asked her to describe the situation.
Hi, yes. The sudden U-turn of the zero-COVID policy and the rapid wave of COVID spread apparently has revealed the fragile healthcare system of China and the failure to implement vaccination drive to the vulnerable populations, such as the elderly. So we are seeing that the surge capacity of the infrastructure in China being saturated very fast, with the newly diagnosed cases every day. Hospital beds are overloaded, medications are in shortage, and this has caused a spillover effect to places like in Singapore and in Taiwan, where the over-the-counter medication for flu are being brought out to be sent to China to help friends and family there.
None of this is a surprise, considering the zero-COVID policy is now over. So how prepared was China for this?
Yes, China was probably the last major country to hold on to harsh zero-tolerance policy towards COVID. But China probably overlooked the reason for any country to hold harsh containment policy towards any pandemic, which is to buy enough time for other preparedness to be implemented, such as vaccine and medications. So we're seeing that the Chinese government has failed to actually implement a broader preparedness program, a plan in terms of how to cover the majority of the population with more effective vaccines, such as the mRNA technology, and also to stockpile the antiviral medications and even the fundamental as the flu, the anti-fever medication. So we see that the communication and is lacking in the public domain to actually educate the elderly, to encourage them to come up to get vaccinated. And we see that the elderly population are the most vulnerable group for this new wave of COVID hit.
Just briefly, do you see China getting on top of this anytime soon?
We hope so, because we know this will have tremendous impact globally, because first of all, the supply chain probably will be disrupted if a lot of the workforce is out of the duty due to COVID. So we think that they could probably, the first thing they could do is to speed up their vaccination drive now and probably be more tolerable on welcoming other foreign vaccines, such as the mRNA technology vaccines. We know that they are now opening up for the foreign expats in China to get the mRNA vaccines, whether or not they could consider to give the same vaccine, which has been proven to be more effective than their own vaccine to their own population.
Okay.
We hope that they would consider this.
Thank you very much for your analysis, Professor Ruby Huang in Taipei.
Spoke earlier with Maximilian Gertler. He's an epidemiologist at the Charité Hospital here in Berlin. I asked him how concerned he is about the pandemic reports emerging from China.
Yes, we see, as you said in the report, 1.5 billion persons vastly under-vaccinated or even naive to the virus. We see most public health measures to contain the spread have been lifted. and the holiday season with dozens or hundreds of millions of Chinese going to travel in the next weeks, this is indeed concerning, yes.
Should other countries outside of China be worried about possible spillover effects as the virus rips through the country's huge population there? Would travel bans make sense?
What is so concerning at this moment is the non-immunization or low-grade vaccination in the Chinese population. For countries receiving travelers from China, their prognosis depends very much on the level of immunization in this new population. Then, so I would not expect important spillovers in those countries.
You're talking about immunization there. Would access to more and different vaccines make a difference for China's population at this point?
I mean, we've seen in many studies that the best immunization is based on getting different vaccines, having a heterogeneous immunization status. And this is what is lacking in the Chinese population. So vaccine activities over the past months would have been, of course, an important advantage now. But now time is very, very short to change through new vaccination campaigns.
Maximilian Gattler, epidemiologist at Berlin's Charité Hospital, thank you so much.
Well, Ruby Huang joins us from the School of Medicine at National Taiwan University. She's been monitoring things in China. Thank you so much for taking the time to speak with us. We have a new report from the news agency Bloomberg saying that Chinese health officials believe almost 37 million people may have been infected on a single day this week. It sounds like a shocking number, but does that sound plausible to you?
Yes, I think it's an awful lot of number, but the issue about data coming from China is we're not sure whether these are accurate. But let me give you some estimations. Like, for example, in Taiwan, we have 23 million population. Now we are seeing 20,000 cases per day of infection. And if you do the math, China is 60 times of population. So we are seeing probably you should get 1.2 million new cases each day. However, the vaccines that the Chinese are using are not as effective as what we've been using in many other places. So you probably need to multiply, the ineffectiveness in protecting the new infection. So probably 37 million per day is a bit exaggerating. I hope it's not true. I'm thinking, above like 6 million per day probably is roughly the right number that we should be seeing. But again, this is a very challenging time for Chinese authorities to come up with accurate data to be given out to WHO.
Now, you mentioned those vaccines. Those are obviously one piece of the puzzle. How prepared otherwise do you think China was for these spiking caseloads?
I don't think they're prepared, and I don't think they have enough communications to the public to how to cope with this upcoming wave. I think the sudden U-turns and the rapid spread of the virus is a shock for everybody and has revealed a tremendous challenging time for the fragile healthcare system. So I think what needs to be moved forward is one, to speed up the vaccination drive, particularly to the elderly, the vulnerable. So far, only 40% of those above 80 years old in China has received at least one booster dose, meaning 3 vaccines, and this is not enough. And second, alleviate the burden of the healthcare frontline as much as possible, which is to triage the severe cases away from the mild cases, encourage people to stay home for those low-risk patients, and they have very good public app systems, probably use the app system to teach the public, under what circumstances they can stay at home and rest and recover, and only come to the healthcare facility for those vulnerable with comorbidities.
Ruby Huang from National Taiwan University, thank you so much for sharing those insights with us.
Thank you.